Is robotic surgery in Kazakhstan the future, or is it already the present? Using robotic systems during surgery reduces blood loss by about 1%. These machines offer a level of dexterity beyond human capabilities. Robotic technology has shown that procedures can be twice as fast and far more accurate. While robots ease the physical demands on surgeons, could they eventually replace them? The day isn't far off when a robot might perform a full surgery without human hands. But who takes the responsibility if something goes wrong? It shifts how we train and what it means to be a surgeon. In Kazakhstan, robotic surgery is no longer a futuristic fantasy. It's becoming part of daily medical practice, transforming the way complex procedures are performed and elevating the standard of high-tech care. Today, surgical robots are being used in some of the most demanding specialties: abdominal surgery, urology, gynecology, neurosurgery, and oncology. This condition is complex. It causes epileptic seizures and carries a serious risk of intracranial bleeding. That's why surgical intervention is often required, and it's considered one of the most challenging procedures in neurosurgery. Manjil Kubrat is a top-tier neurosurgeon specializing in neurovascular surgery. For over 15 years, he has performed endovascular procedures, a minimally invasive technique that uses small incisions or punctures to access blood vessels in the head and neck.
Цель вмешательства – остановить переток из артериальной части в венозную.
The goal of the operation is to stop abnormal blood flow from the arteries into the veins.
Не выдерживать артериального давления. Это все-таки венозный сосуд, и
This type of flow can be enormous pressure on vessels that aren't designed to handle it. Venous vessels typically operate under low pressure, around 20 millimeters of mercury, while arterial pressure can reach up to 120 millimeters of mercury. That mismatch can be dangerous. Neurosurgery is a fascinating field, one of the most complex in all of medicine. It draws from multiple disciplines: surgery, neurology, and even trauma care. Neurology itself is notoriously difficult. It's not a specialty that comes easily to most medical students. But the more challenging the path, the less competition you face. That's true not just in medicine, but in business too. If you want real growth, you choose the hard road. We approached the feeder vessel and used a special liquid embolic agent, essentially medical-grade glue, to seal it off, blocking the abnormal blood flow from the arterial side to the venous side.
Тем самым переток из артериальной части кровотока в венозную закрыли. Эта методика в Казахстане внедрена была.
This technique was first introduced in Kazakhstan in 2008 at the National Center for Neurosurgery. Today, it's widely and successfully used in clinics across the country.
Во многих клиниках она успешно применяется.
Robotic surgery was introduced in Kazakhstan in 2018 and has been changing the way complex procedures are performed ever since. So how does a robotic-assisted operation actually work? It starts much like any other surgery. The patient is prepped and anesthesia is administered. But from there, things take a high-tech turn. The surgeon no longer stands over the operating table. Instead, they sit at a specialized console, the command center of the procedure, where they control every movement with pinpoint accuracy. On the screen in front of them is a magnified 3D view of the patient's anatomy. Through 3 or 4 tiny incisions, robotic instruments are inserted into the body. These robotic arms respond instantly to the surgeon's commands. They don't shake, they don't tire, and they can move in ways the human hand simply can't. These shots perfectly showcase the surgical robot's precision. It peels off a strip of grape skin and seamlessly stitches it back together. Last year we began using the Remote system. It enables us to perform stereotactic procedures, particularly for brain tumors, where we need to conduct biopsies, or in cases of Parkinson's disease, where precise electrode placement is critical. We have also used it in diagnosing epilepsy. The technology has opened new doors in how we treat complex neurological conditions. A surgical robot doesn't get tired, doesn't tremble, and doesn't make mistakes from fatigue. It's precise, fast, and efficient. And that's just the beginning. Today, surgical robots are getting smarter. They increasingly integrated with artificial intelligence, allowing certain movements to be guided by virtual assistants. That means greater precision with every procedure. But that's not all. Surgical technology as a whole is evolving. Now we can integrate CT scans, MRIs, and ultrasound images directly into the robotic system. During surgery, the robot can process this data in real time, giving the surgeon constant visual feedback and guidance. This makes every move safer, more controlled, and more informed. Robotic surgery is minimally invasive, requiring no large incisions, which significantly reduces the risk of bleeding. Patients experience less post-operative pain and often require fewer painkillers. Recovery times are faster too. In some cases, patients are discharged the same day or the very next morning. The result is a faster, smoother recovery and an earlier return to normal physical activity.
Эндоскоп операцияның негізгі ерекшелігі емдеу барысында біз ашық операцияға қарағанда
The key advantage of endovascular surgery is that it's done without traditional incisions.
Дәл осы кіші инвазивті, яғни тамыр ішілі біз кез келген құрал-жабдықтарды енгізу арқылы тамыр патологияларын емдейміз. Емдеу барысында бұндай операция
Instead, the procedure is performed through tiny punctures in the skin. It's minimally invasive, which means fewer complications and a significantly faster recovery for the patient.
жолымен ғана емдеп жатқанымызды айтуға болады.
В прошлом году мы впервые в Казахстане внедрили стереотоксическое электроэнцефалографическое исследование.
Last year, we became the first in Kazakhstan to introduce stereotactic electroencephalography, a groundbreaking diagnostic method for epilepsy.
И в течение нескольких часов поэтапно электроды вводились в головной мозг для выявления очага эпилепсии.
Before robotic systems, we had to drill small openings in the skull and manually insert electrodes into the brain over several hours. It was the only option for patients with severe drug-resistant epilepsy. With robotic assistance, we've cut the procedure time in half, improved precision, and made the entire process much safer. In one case, we implanted 13 electrodes into the patient's brain. Afterward, their seizures stopped completely. They made a full recovery. One major advantage of robotic surgery is a significantly reduced risk of infection, a critical benefit in the wake of the COVID-19 pandemic. Most robotic tools are single-use. which ensures maximum sterility and reduces the risk of contamination. In today's world, that's more important than ever. The bacteria we face are increasingly aggressive and resistant to antibiotics. These isolated, sterilized systems give us a much safer operating environment. Robotic surgery is like giving the surgeon an extended reach, one that can span the entire country. Thanks to 5G technology and fiber optic networks, an operation can now be performed remotely, even from thousands of kilometers away. The shift is profound. It's no longer the patient who has to travel to the capital. Now the capital's top surgeon can travel virtually to the most remote corners of the country, areas once out of reach for complex procedures, and now seeing life-saving possibilities open up. With high-speed fiber optic and 5G mobile connections, surgery can now be performed remotely, even from the other side of the world. That's a game-changer for regions that lack access to highly trained specialists. And for a country like Kazakhstan, this kind of connectivity is especially valuable. Yes, the robot handles delicate movements with unmatched precision, but humans are still at the heart of the process. Even in remote surgery, trained nurses are always present in the operating room. They monitor the patient's condition, ensure the equipment is running smoothly, and are ready to step in if needed. And the best part? Preparing skilled support staff takes far less time and investment than training a top-tier surgeon, making this model more accessible and scalable than ever before. Thanks to Kazakhstan's healthcare policies, we've been able to acquire and implement robotic surgery systems across a range of specialties. We already have extensive experience using them in abdominal surgery, gynecology and urology. Looking ahead, we're planning to expand their use in neurosurgery. And in Astana, several clinics are now using a robotic system in orthopedic procedures as well. Robotic surgery eliminates the need for large incisions. For example, in abdominal procedures, everything is done through 3 or 4 tiny openings, leaving patients with virtually no visible scars. Right here in this neurosurgical operating room, we performed over 250 procedures last year, and 99% of patients avoided traditional craniotomy. Robots have become trusted allies in the operating room, but can they truly replace human surgeons? We're getting close to the day when a robot could perform an entire surgery on its own. The question then becomes an ethical one. If something goes wrong, who is responsible for the outcome? Technology brings hope, but the final decision will always rest with the doctor. Because in the end, we don't just trust a steady hand, we trust the human behind it. There was a viral video, I think it was on Instagram or TikTok, about how much the world has advanced, and yet blackboards and chalk are still used in classrooms. It struck a chord with me, because even on the day when the robots become a permanent part of surgical practice, the scalpel, and more importantly, the surgeon's skill and judgment will still matter. They will never lose their relevance. I don't believe robots will ever fully replace human surgeons. It's simple. A robot can be programmed to do one specific task, but a human being can adapt, multitask, and handle the unexpected. A patient might marvel at the robot's precision, but in the most critical moments, they will still seek out the eyes of a doctor, because only a human can offer more than a procedure. A human can comfort, reassure, and give hope. Sometimes, all it takes is just a look and some reassurance. You're going to be okay.